Welcome and thank you for watching this video. My name is Richard Box, Senior Clinical Specialist at Canon Medical Systems Healthcare Imaging Technologies. And I will take you through this presentation about our automation platform, powered by Altivity. Let's first talk about some market trends. In healthcare, we see a continuously aging population globally. Workload keeps increasing with limited resources, combined with an increased need to make informed decisions in real time at the point of delivery. There is a transition to a more personalized treatment approach and a desire to optimize resource deployment, ensuring clinical teams have the insights they need. We are introducing Altivity, our bold new approach in AI innovation, using smart technologies to make a whole new level of quality, insights and value across entire care pathway possible. With Altivity, we provide informed healthcare to ensure your clinical confidence with quality images and integrated data that help you make informed decisions in real time at the point of delivery. Fast, tailored care. Altivity has been created with your patient in mind. To deliver fast and accurate results they need with a more personalized approach. Efficient workflows. Altivity helps create simple, streamlined AI-driven workflows that optimize resource deployment and ensure your teams have the insights they need to work smarter every day. One part of Altivity is the automation platform. The automation platform is an AI-based, zero-click solution that uses deep learning technology to streamline your workflow for fast, actionable results every time. To decrease time from scan to clinical decision. For accurate triage, prioritization and treatment decisions. You will automatically receive comprehensive clinical results for access to the right information at the right time. Work faster with a time when time is everything. Here we see a conventional process where the data is transferred to your PACS archive. You will have to search for the images. To select relevant images, possibly load the data in post-processing software for analysis. During your analysis, you will save new images and have to prepare the results for interpretation or multidisciplinary meeting. With our AI-assisted automated workflow, our automation platform will speed up the workflow significantly by automatically categorizing the images, automatically analyzing and detecting abnormalities, and send out alerts or email results for interpretation. This will reduce the burden on your staff, increase productivity and save time. Please see here how the automation platform makes it happen. The images are automatically received from the scanner. The automation platform will categorize based on image data, dispatch the data to the relevant AI algorithms. These applications run automatically and the findings are exported automatically as DICOM images and insight result summary to your DICOM archive, as well as email alerts with the insight results. Together with the original data that is sent from your scanner to your DICOM archive, you will have everything you need for a comprehensive evaluation on your preferred diagnostic viewer. AutoStroke is part of the automation platform. AutoStroke is there for accurate stroke characterization with fast results due to an automated workflow which reduces the number of time-critical decision points to optimize resources for treatment. High accuracy, optimized patient triage makes it easier to prioritize your most challenging and urgent cases with high confidence. Expert collaboration make the most of the automated actionable insights delivered to the entire care team from scanner to treatment. A unique approach to evaluating stroke. The AutoStroke contains 4 applications: non-contrast CT, intracranial hemorrhage detection, aspect scoring, large vessel occlusion detection, and brain perfusion evaluation. The intracranial hemorrhage detection detects multiple types of hemorrhage, with the input data being non-contrast CT, thin or thick slices. Potentially also trauma patients. The aspect scoring provides automatic semi-quantification of the 10 regions. The heat map scale is for easy visualization. Input data is also non-contrast CT, thin or thick slices. The large vessel occlusion detects occlusion positions in multiple vessels to determine if thrombolytic therapy or treatment can be applied. Input data is contrast-enhanced CT, thin slices. Lastly, the brain perfusion application for analysis of blood flow in the brain using deconvolution algorithm with a Bayesian estimate. Perfusion scanning with 2D or 4D is possible and can be used to determine if thrombolytic therapy or treatment can be applied. By using the Bayesian algorithm, we introduce some major benefits, being an increased accuracy, noise and delay flow insensitivity, and insensitivity to truncation. As you can see on these results, the quality of the maps are superior. We are also proud to present to you our new chest pain applications. With this, you will have access to pulmonary embolism detection and aorta dissection detection. The pulmonary embolism detection provides fast, automatic detection on chest medical images. Detection takes place on contrast-enhanced CT angiography. The algorithm detects emboli in main, intralobular, lobular, and segmental arteries. The aortic dissection algorithm is for the detection of dissections on contrast-enhanced CT angiography. It can identify type A or B dissections. And the analysis is of course performed from aortic root down to bifurcation. all of this information is consolidated in the Insights results. The Insights results provides an overview of the patient's results in one comprehensive summary. Review is possible on a mobile device, PC or PACS, and by email. The Insights results are easy to review and interpret for fast decision making. See the example of a positive intracranial hemorrhage on the left and a summary overview of the perfusion results on the right. Please watch the following video of an clinical expert, Dr. Anton Meijer from the Radboud University Medical Center in the Netherlands, and hear all about his clinical experience with the automation platform.
My name is Anton Meijer. I am a neurologist at the Radboud University Medical Center in Nijmegen, the Netherlands. And I have to disclose that at our department we use Canon CT scanners for performing acute stroke imaging. A new perfusion algorithm which is now available is the so-called Bayesian perfusion. Bayesian perfusion is a probabilistic estimation of the perfusion values and is also delay insensitive. Bayesian methods are less sensitive to noise and enhance the diagnostic reliability of ischemic stroke detection. And the Bayesian method can be combined with prior noise suppression of the acquisition. For example, the application of a 4D similarity filter in order to further reduce the noise in the images. This is illustrated by this case. In the upper row there is the default deconvolution method, the singular value decomposition, and in the lower row there is the Bayesian CT perfusion. In this case there is a left side perfusion deficit in the brain, which is more easily identified on the perfusion maps because there is less noise and an improved demarcation of the affected area, here seen in the cerebral blood flow and the mean transit time maps. And this perfusion deficit correlates well with the MR diffusion imaging. Another case, patient with the left side thalamic perfusion deficit, which is more easily identified on the Bayesian perfusion maps because of a reduction in image noise. And this again corresponds well with the brain diffusion imaging. And in a larger data set at our site, we have indeed demonstrated that the overall image quality of the perfusion maps is judged higher for the Bayesian CT perfusion in comparison to the singular value decomposition. Image noise in the CT perfusion maps can be further reduced when applying deep learning image reconstruction prior to the Bayesian perfusion algorithm. And this is illustrated in this case with superior quality of the image maps. When selecting patients for therapy in extended window, this is done by estimating the volumes of the infarct core and the penumbra areas, as has been demonstrated in the dawn and diffuse studies. In those clinical studies, the rapid software algorithm was the default method of the perfusion processing, but it has been shown that Bayesian CT perfusion is non-inferior for estimating the infarct core and penumbra areas. In the last part of the presentation, I will discuss some developments on CT perfusion. One really important development is that CT perfusion is really integrated in the workflow by an automated processing, so a zero-click solution. This saves time and for the diagnosis, but it can also be combined with AI support for the detection of pathology. So the perfusion deficits can be automatically detected and tissue viability estimation is readily presented to the reader. It can also be combined with automated detection of hemorrhage on non-contrast CT, the identification of early ischemia, but also the detection of intracranial vessel occlusions on CTA and the evaluation of the collateral stratus. These developments are taking place now and different packages are available for application in clinical practice. And this integrated workflow aids the radiologist and clinician for making both a fast and accurate diagnosis, which is really important in the diagnosis of acute ischemia. In order to further reduce the radiation dose and save contrast agent, but also to save time, the CT perfusion can be combined with the next CTA acquisition. So this is one acquisition where one time point of the CT perfusion is substituted with a volumetric CTA acquisition of the neck by rapid table movement. With that, I would like to summarize and stress that brain CT perfusion makes life easier in the diagnostic workup of stroke because it aids to make both a fast and accurate diagnosis. Brain CT perfusion can be easily integrated in the clinical workflow, and automated processing of both CT perfusion, but also the non-contrast CT and CTA is of added value and will aid to improve the outcome of the patient. And with that, I would like to thank you for your attention.
In summary, with the automation platform, as part of Altivity, we provide you informed healthcare, fast, tailored care, and efficient workflows. I would like to thank you for watching this video, and on behalf of Canon Medical Systems, we wish you a great continuation of the online ECR Congress and hope to see you in July.